Hello, and thank you for joining us on this video dealing with loss, grief, and bereavement in the midst of the COVID-19 pandemic. We at ALNIC have taken our slides that we use for our core curriculum and adapted them for the pandemic with the hope that discussing loss, grief, and bereavement with you will be a help as you take care of patients and families and yourself amidst this really challenging time. Just to kind of give you an overview of what's typically in these slides, we talk about definitions, and we spend a lot of time talking about different types of grief and then the bereavement period. But we know that this COVID-19 complicates what is considered normal grief and loss experiences at end of life. This is anything but normal. So it makes it very challenging for us to be able to ensure that there's good follow-up care for family members after they lose their loved ones. It's important for us to keep in mind that everyone grieves in their own way, and that grief is heavily influenced by previous experiences with death, with loss, and heavily influenced by their cultural values, practices, and beliefs. And ideally, as we know in all of palliative care, all these concepts are best attended to by an interdisciplinary team approach. And that includes the concept of grief, because we really need to attend to mind, body, and spiritual needs when someone has experienced a significant loss. But we recognize that during this pandemic, you as the bedside nurse might not have these team resources available to you. So we're hoping to give you some guidelines to help you with this as you, as the nurse, kind of provide all domains of quality of life care to family members who are suffering. We always emphasize the importance of understanding the definitions and of what these are, but keep in mind during the pandemic, as I said, we are seeing families being put at risk for a long grief process that is often very complicated. Death is hard enough on its own, but you add this pandemic to it with family members not being able to be with their loved ones at the time of death, it's going to make it really difficult. And there's also going to be an impact on the bereavement period. We know what that in normal Western culture typically is. It's a little bit crazy in that, what do you usually get off from work 3 days to sort of plan a funeral and have a burial, and then you're supposed to kind of come back to work. Well, in this day and age, family members are not able to even have those brief few days of bereavement because they are not able to hold the normal funeral services that we've often seen, or hold a mourning period if that's within their culture, the way we have had in the past and the way we've done culturally in the States here across different religious practices. So we've said that families are really at risk for complicated grief, and that is a response to a loss that's more intense and prolonged than usual. And it certainly will have an impact on family members' ability to return to a new normal. We know from the literature that risk factors associated with complicated grief include things like sudden unexpected death or a traumatic death. Certainly COVID fits that. Multiple losses occurring close together. We certainly see that families are experiencing not only the horrible loss of their loved one, the loss of being able to be with their loved one during that dying process, loss of financial security due to the COVID virus, loss of employment, and certainly for some families, unfortunately, multiple family losses within one family because of the COVID exposure. So lots of concurrent stressors. And as I mentioned, isolation is a huge one. They can't be with their loved ones. They're suffering in isolation. The loved one is suffering in isolation, dying alone. And another huge loss that we're seeing is the lack of ability to access our team members that we traditionally have used to provide great end-of-life care, our social workers, chaplains, counselors, child life workers, etc., because we are limited by the number of people that can be involved in care for a patient with COVID-19. And as we said, these patients are very, very, very seriously ill. Often we're hearing more and more stories about people who actually were relatively healthy and all of a sudden developed COVID-19 and rapidly declined, and some of them died. We do know that this is more typically a disease of those who are older, and especially those who have multiple comorbidities, but maybe they weren't close to end of life with that heart failure or their COPD or their metastatic cancer, and then the COVID-19 virus resulted in a sudden decline and death, and the nurse is witnessing all of these unexpected deaths and horrible suffering as a result of it. What do we know that family caregivers want when they're grieving? Well, we know from the literature that they really want us to honor their loved ones' wishes. They want us to know what those wishes are and then respect them. So, for example, if a patient is saying, I never want to go to the ICU again and be intubated, I've lived with my COPD long enough, I don't want this to happen again, then families, in discussion with them, typically want us to honor that loved one's wish. They want us to make sure that we include them in decision making, when keeping them updated and what's going on and communicating with them. They want support from the whole team. They want the team to be all on the same page, and they want honesty and transparency. And the old days of people not wanting to hear the truth are long gone. Typically, most family members want to know exactly what's happening so that they can be prepared, and for many, so that they can do important tasks nearing the end of life that they wouldn't have the opportunity to do if they didn't know that the end of life for their loved one was coming in the next 48 to 72 hours. We know those are what they want, but COVID has impacted our ability in some cases to provide that. It may be that we don't know what the loved one's wishes are because they're too ill when they come into the emergency room and they decline too rapidly while we're struggling to find the surrogate caregiver to actually know what their preferences are. So there may be instances when their loved one's wishes are not necessarily honored just by virtue of how rapid the decline is and how quickly the illness changes in a matter of sometimes even minutes. We certainly know that this rapid decline influences the ability to get family input, especially in emergency decision making. And families that were hoping that we would be supportive of them and the team would all be there for support to them, they can't visit. They're not getting the team members support, and sometimes not all the team members are even available to provide support by phone. A huge challenge. And certainly in terms of honesty and transparency, the only mechanism of communication in many times is by cell phone, an iPad, and it certainly hindered. We don't have the luxury of having family members right in the room where we can keep them updated on the latest changes. So it's so important to have a communication plan in place to let them know what's happening and to hold true to the planned scheduled calls with the family members, that you will be honest and transparent about what is happening. They want to be listened to. They want you to, on the other end of the phone, let them certainly talk and share their grief. They want to know that their loved one is going to be remembered and that they're going to be remembered. And very importantly, they want to know that they did everything they could. And that's so hard because they can't do the one thing that most of them really want to do, and that's be with their loved one. The only way you might be able to make that happen is virtually with an iPad Or in some instances, there are some institutions that are allowing one visitor to come into the patient's room and stay there until the patient actually dies. But that is limited in some states and in some settings. So it's important for you to help them know that they're doing everything they possibly can amidst this pandemic to be able to support their loved one. And the only way may be through the iPad and cell phone. The grief process itself waxes and wanes. It's often been likened to being in the ocean where things can be really calm and then all of a sudden a huge wave knocks you over. That's normal and expected. But the emotional waves that are going to come with this are going to be much more complex because of the issues we've talked about. And certainly, huge challenges post-mortem and families not being able to be together, to hug each other and grieve in their culturally appropriate manner. They may not be able to even secure a morgue or a funeral home. Certainly in some of the hot spot cities, there are limited access to morgues, and there are funeral homes that are no longer accepting bodies. This is really a huge problem for families and can cause unnecessary suffering that we wish wasn't going on top of everything else that is so traumatic. And then, of course, we're seeing in the obituaries, we read them every day, that funerals are delayed until after the pandemic. They'll report where the body has been transported to and that the family will have a celebration of life or whatever arrangements are being made after the pandemic is over. So a really challenging time in terms of the normal grief process being completely rewritten during this pandemic. And that can be complicated by, having unresolved family issues that make it even more challenging to grieve the loss. So how can we encourage grief support at this difficult time? Well, we can ensure that the family members know that they need to be connected to a program of some kind. You need to refer them to either a hospice program in their community or maybe to a social worker or chaplain to follow up at your institution by phone to let them know what's available in terms of group and community support or individual counseling. Because what we do know is that they are not able to grieve as they traditionally would have in the past, and they've got to put a plan in place to get some either online support, individual counseling, or group support after the pandemic is over. Sort of highlight this with a case study. I think we can all relate to these stories. This is a 83-year-old woman, Mrs. T, who has diabetes and end-stage COPD. She's not a candidate for a ventilator because of her end-stage COPD. And she also verbalized to us that she never wanted to be intubated again. So she's now dying on the inpatient COVID unit. Her husband of 60 years can't be with her in this COVID ICU. Both are grieving the separation and her imminent death. And their two adult children live over 500 miles away and cannot travel and get there because of the complexities of the pandemic. So how can the nurses support Mr. and Mrs. T and the family during this crisis? Well, we have to honor and respect the CDC guidelines for safe care, and we all know what those are. And certainly whatever your institution guidelines are, we want to be consistent and fair and just to everyone. So we can't allow an exception by having Mr. T come and be with his loved one if your institution is not allowing that. Certainly advocating for a hospice referral if possible is a really important thing to do, especially patients going to be transferred out onto a medical unit and can be cared for by the hospice team as well there, as well as the nurses that are inpatient. And many institutions, as I said, do allow one visitor with the appropriate PPE and also with a commitment to stay with their loved one through death and not come in and out of the hospital. So we have to respect the guidelines, both from CDC and from your institution, and we have to be fair and just to all so that we follow these guidelines with everyone. If the family can't be together, I know I'm hearing wonderful stories of nurses using cells or iPads to connect and to help facilitate important conversations. We talked about those conversations in our little video presentation on final hours. Ira Bayek suggests things like saying, I love you, goodbye, I forgive you, you forgive me, and encouraging reminiscence and thanks for the life that you shared together. It's also important that we let Mr. T and his adult children know that we're taking as great care of his wife as we possibly can, even though she is alone in this room. Let him know how often we're going in there. Let him know that we are reassuring her that she is not alone, that we are here 24/7 and will respond as quickly as we possibly can to her needs. And let him know what symptoms are being managed and how we are attending to her comfort. Important to let Mr. T and his children talk about their feelings and the angst and suffering that they have about not being able to be with their loved one. If possible, if you have palliative care available or interdisciplinary team members that are available by phone, they can provide some support if you still have them accessible in your institution. And certainly, if you don't have them, you want to make sure that you are assessing, is Mr. T, who is home alone, eating and sleeping, taking his medications? Does he need a referral for social work to get food into the house or have someone checking on him and helping to facilitate a support system for him in his own home is also important. And in addition to caring for Mrs. T's husband and family, we've got to care for each other. We're experiencing many, many, many losses, in addition to the many patients that we are losing. Nurses are sharing with us they're losing the ability to give the care that they're used to providing because they have to be in the room for limited time. They are short-staffed. They are working long shifts. They're exhausted. Maybe they have limited resources or medications at their institution or fear of limited equipment. And it's certainly impacting their care. And unfortunately, we're hearing stories of some nurses experiencing the death of their healthcare colleagues, their other nurses or team members due to the coronavirus, additional losses on top of the multiple deaths that they are being witness to, and the other losses that they may be experiencing in their own home life. Find creative ways to support each other, leaving supportive notes for your colleagues, maybe tacked on a bulletin board or in the bathroom. Try starting each shift with maybe an uplifting quote or reflection, a moment to sort of set the tone for the day in a more positive way rather than a negative one. And try at the end of each shift to remember at least 3 things that you and your staff did really well that day. Got to emphasize the positive to be able to get through this challenging time. And then we as nurses are not great about taking breaks, whether they're bathroom breaks or lunch or snack breaks. We've got to support each other and encourage each other to do that, because if we don't take care of ourselves, we can't take care of others. On behalf of the entire AOCN team, I want to thank you all for the great work you're doing. We hear stories every day on the news and from our colleagues across the country that are sending us emails and beautiful voice from the front lines that tell us that you are the real heroes. Thank you for the great work you're doing. Please take care of yourself. You can't continue to do this work if you don't do that. And we are here for you, cheering you on. We've left some references available for you that we hope might be helpful, and we have additional resources on our LNIC webpage with great things to access that are supplemental materials to deal with loss, grief, and bereavement that we hope you find will be supportive to you as well. Please take care, stay safe, and stay well. Thank you.